Assalamualaikum everyone. My name is Dr. Unjeet, working as a private practitioner. The overactive bladder is the condition where the bladder muscles contract involuntarily and cause immediately urgent need to the urinate. This is the distinct condition in the man and woman. There are many causes. The possible causes include the neurogenic cause, such as the Parkinson disease, as the stroke and the spinal disease. UTI and the urine stones are most common cause. Number second and number three, some of the medication may also cause the overactive bladder. Lifestyle changes such as excessive intake of the tea, coffee, alcohol, and irritant smoking are the contributing factor for the overactive bladders. And the excessive weight, enlarged prostate, and the cancer of the urinary tracts are also cause for the overactive bladder. The understanding for the overactive bladder has also progressed, and the mechanism of the treatment for the overactive bladder has also progressed. When the patient visits to the doctor has to evaluate the cause for the most common cause, the diabetes, kidney function, and the urinary tract infection and the renal stone. If no such cause is found, then he is looking for the lifestyle modification, such as to limit or reduce the intake of the waters or the coffee, smoking, and reduce the weight. And further, he is or she is asked to not allow the urinary bladder to overfill and visit the toilets periodically in the manner so to reduce the leakage and urgency of the urination. In the recent years, some new effective treatment modality has also been established, and there are some new drugs such as the beta 3 agonist and the anti-muscarinic drugs have been introduced. These drugs reduce the contractility of the urinary bladder and prevent the leakage and urgency of the urination. If some patient thinks that these drugs are not effective and there are more side effects associated with intake of such drugs, there is other treatment option available. Intravesical botulinum injection is the given. This is the chemical which is injected to the bladder through the cystoscopy. This drug reduces the contractility of the urinary bladders and because it paralyzes the nerves of the urinary bladders. This treatment procedure is repeated after 2 to 3 months. There are other options also treatment available such as the neurological modulation and interstitial insertion of the pacemaker and posterior tibial nerve stimulation, which also stimulate the sacral nerves supplying to the urinary bladders and also causing the reduced contractility of the urinary bladder. If someone he or she is suffering from the overactive bladder, he must immediately consult to his doctor, and this not need to be worried about. Thank you very much for watching.